Imagine like injecting a compound that actively seeks out torn muscle fibers and just literally builds new blood vessels around them in a matter of days.
It sounds like pure science fiction,
Uh,
honestly.
it totally does. But now, imagine a completely free AI assistant mapped out that exact biological protocol for you this morning, tailored specifically to your body and your goals.
Yeah.
Welcome to 2026.
Yeah, it's really an incredible time to be alive. I mean, we are looking at a landscape where the barriers to entry for extreme health optimization have basically just vanished overnight.
Exactly. You no longer need a PhD in biochemistry or
Yeah.
like a team of absurdly expensive exclusive consultants to optimize your health.
No, not at all.
It is a massive, empowering win for everyday people. And today, we're unpacking an incredibly detailed guide on this exact phenomenon.
Yeah, it's going to be a good one.
So our mission for this deep dive is to explore the ultimate playbook for 2026, which is the AI-assisted peptide research framework.
Hmm.
We're going to break down exactly how you can use these tools to safely research and design your own cutting-edge biochemical protocols.
But before we get into the actual mechanics of this framework, we have to establish the absolute most critical foundation for this deep dive.
Yes, the mandatory medical disclaimer. We really need to be crystal clear with you, the listener.
Absolutely non-negotiable.
Right. This deep dive is strictly for educational purposes. It does not constitute medical advice, like at all.
Yeah, and it's important to note that peptides are research chemicals, and the ones we are discussing are not FDA approved for human consumption.
That's right. You must always consult a qualified healthcare provider before trying any of the protocols, or supplements or biohacking strategies we discussed today.
Exactly. The authors of our source material, and we as your guides, are not liable for any adverse effects.
Yep. Individual results vary wildly, and this content is purely informational. Think of these AI tools like an ultra-smart GPS for your health journey.
I like that analogy.
Thanks. Like they can analyze the terrain, they can plot the most efficient route, and they can warn you about massive traffic pileups or hazards ahead.
Right, and this is a massive, but a licensed doctor is still the one who needs to be behind the steering wheel.
Exactly. AI does not diagnose you, and it certainly does not prescribe medication.
That is the perfect framing. I mean, AI helps you understand the complex research so you can be a highly informed participant in your own optimization.
Right.
But these roles, like the AI research assistant and the licensed medical doctor, they are complementary. They are absolutely not interchangeable.
All right, so with those safety guardrails firmly in place, let's hop into the time machine for a second.
Oh boy. The dark ages.
Yeah, because to really appreciate why this AI workflow is so revolutionary, we have to look at the absolute nightmare of how things used to be done.
The dark ages of biohacking, which incredibly was just like a few years ago.
It's wild to think about.
It really is. Historically, if you wanted to research peptides, you were looking at a profoundly frustrating manual slog.
Oh, totally.
We're talking about spending 40+ hours just digging through scattered, fragmented sources.
Yeah, you'd be cross-referencing these dense, impenetrable academic papers on PubMed, trying to translate the jargon yourself.
Exactly. And then jumping over to Reddit or Discord or underground forums to see what actual humans were experiencing in the real world.
And it was just a mess of conflicting data. Like, you'd have one forum post swearing by a certain dose and another saying that exact dose did absolutely nothing.
Yeah, the classic bro science confusion.
Right. But I have to ask, if these peptides are so powerful, why was the information so fragmented in the first place?
That's a great question.
Like, why wasn't it just clearly published like standard medication you'd get at a pharmacy?
Well, it really comes down to the fundamental nature of these substances. We are talking about decentralized research chemicals here.
Okay, so not mainstream pharma.
Right. These are not mainstream pharmaceuticals that have gone through standardized, multi-billion-dollar commercial pipelines. Because they exist outside the standard commercial medical infrastructure, the knowledge base was built organically and, quite frankly, very chaotically by independent researchers, elite athletes, and biohackers.
Wow.
Yeah, there was no single centralized authority organizing the dosing or the safety profiles or the supplier verification.
Which makes total sense. It was just the Wild West out there.
Completely.
So I just have to express sheer relief that this era is over. The fact that years of fragmented research can now be compressed into just days is staggering.
It's a total game changer for everyday people.
But, just having access to AI isn't enough to solve that chaos, right? I mean, I can't just open my phone, type make me healthy into a search bar and expect a safe protocol.
Right. No, that's exactly how people get into serious trouble. The framework our sources outline isn't just one generic prompt.
Right.
It's a highly specific, systematic, repeatable process that builds upon itself. It's essentially a three-layer arsenal.
Okay, I love the sound of that.
Yeah, so layer 1 is real-time research, layer 2 is understanding mechanisms, and layer 3 is the safety analysis.
Okay, let's break those down for the listener.
Wow.
Layer 1 is driven by perplexity.
Yes.
And perplexity is a massive deal here because it completely eliminates those manual PubMed searches. It operates in real time, finding the absolute latest 2025 and 2026 clinical studies.
What's really fascinating here is how it synthesizes the data. It's not just a search engine.
Right, it doesn't just give you links.
Exactly. If you go to Perplexity and ask, what are the most recent clinical studies on TB500 for athletic recovery, and what dosages did they use?
Yeah.
It doesn't just hand you a list of blue links to click on.
Okay, goodness.
Yeah, it actively reads the recent papers, synthesizes the findings, pulls out the actual dosages used in the human or animal trials, and provides clickable citations.
So you get the newest empirical evidence instantly.
Instantly. It's incredible.
Okay, so layer 1 gives us the raw clinical evidence. Then we move to layer 2, which is all about ChatGPT. I sort of view ChatGPT in this workflow as the ultimate translator.
Mm-hmm.
You take that dense clinical data from Perplexity and you feed it into ChatGPT to understand the how.
Exactly. You basically ask it to explain the mechanism of action. Because knowing that a peptide works isn't enough. You need to know why it works.
Right, but here's where I have to play devil's advocate and push back a little bit.
Go for it.
Why do we need 3 different AIs? If I'm sitting at my computer, jumping between 3 different interfaces feels like extra work.
Yeah, it sounds a bit tedious at first.
Right, like, can't I just ask ChatGPT to do the research, translate it, and check my safety all at once?
It's a very common question, but trying to use one AI for everything is actually a potentially dangerous mistake.
Oh, really? Dangerous.
Yeah, because each of these models has specific architectural limitations. If you rely solely on ChatGPT, you're going to hit a wall because its training data has a cutoff.
Ah, right, the cutoff date.
Exactly, specifically April 2024 for the models discussed in our sources. So it literally cannot know about a breakthrough safety study published in late 2025.
Oh, wow. Okay, so that's why we use Perplexity,
Mm-hmm.
the real-time research.
Yeah.
It's actually connected to the live internet.
Precisely. Perplexity gathers the live data. ChatGPT translates it. And that brings us to layer 3, which is Claude.
Right, Claude.
Claude is positioned in this framework as the ultimate safety net. While Perplexity is great for search, Claude has vastly superior reasoning capabilities for complex, multivariable logic.
Okay, so if I'm understanding this correctly, Perplexity, it's kind of like the detective gathering the raw evidence from the crime scene.
Oh, I like that.
Right, and then ChatGPT is the lab technician explaining what that evidence actually means in plain English. And Claude is the tough judge making sure the whole case actually holds up in court without any fatal flaws.
That is a brilliant analogy. That's exactly how they function together in this playbook.
So what does this all mean in practice for you, the listener? How do you actually use the judge?
It means you take your proposed protocol, the exact peptides, the dosages, the frequency, and you combine it with your personal health details.
Like your medical history.
Exactly. You write down any existing conditions, genetic markers, or medications you're currently taking. You feed all of that into Claude and ask, analyze this for contraindications and drug interactions. What could go wrong?
And it just catches things.
Yeah, Claude will reason through the complex molecular mechanisms and catch dangerous interactions that a human or even a simpler AI would very likely miss.
That's incredibly powerful. Right, now that you have the blueprint for the AI tools, the detective, the lab tech, and the judge, let's pivot to what you can actually build with them.
The fun part.
Exactly. The playbook details 3 specific goal-oriented elite stacks.
Let's start with the first one, which is the performance recovery stack.
Nice.
The goal here is accelerating muscle recovery, healing connective tissue, and crushing post-training inflammation. The expected timeline for noticeable improvement is about 4 to 8 weeks.
Okay, so I actually fed this performance recovery goal into the workflow we just talked about. And it spit out a protocol combining DPC 157 at 250 micrograms daily and TB 500 at 2.5 milligrams weekly.
A very classic stack.
But looking at these, I have to ask, Why combine them? Don't they basically do the exact same thing? Why not just take more of one?
See, that's exactly where Layer 2 ChatGPT shines, because it explains the differing mechanisms. They don't do the same thing at all. They work synergistically.
Oh, okay.
Yeah, ChatGPT explains that BPC-157 works primarily through angiogenesis.
Which is the creation of new blood vessels.
Yeah, exactly. It accelerates healing by physically building new supply lines to bring more blood and nutrients to the damaged area.
Wow.
But TB500, on the other hand, works by upregulating a cellular protein called actin.
Actin.
Yeah, actin is vital for cell structure and mobility. So while BPC-157 is building the supply roads, TB500 is telling the actual cells to migrate to the injury site and rebuild the tissue architecture.
Okay, that makes total sense. They're attacking the injury from two completely different biological angles.
Exactly.
But here's where layer 3, the judge, comes in. Claude makes a brilliant, critical catch regarding safety for this specific stack.
Yes, Claude points out that if you are taking NSAIDs like standard over-the-counter ibuprofen, you must stop them during this protocol.
Wait, really? Why?
Because if we look at the bigger picture of how the body heals, DPC-157 actually relies on the body's natural inflammatory response to trigger that angiogenesis cascade.
Oh, I see where this is going.
Yeah, NSAIDs are literally designed to shut down inflammation. So if you take them together, the ibuprofen will actively block the very mechanism that makes the peptide work.
That is wild.
Right. Without Claude reasoning through those intersecting pathways, you might completely negate your own expensive protocol.
And you just think the peptides were fake or didn't work. That is exactly why that safety layer is non-negotiable.
100%.
Okay, so BPC-157 is doing the heavy lifting for muscle and tissue repair. But, physical performance is only half the battle of aging.
Very true.
If we want to address systemic aging and the actual elasticity of our skin, we need to target an entirely different biological pathway.
Yeah.
So how does the AI workflow approach longevity?
Well, that leads us right to the second stack, longevity and skin. This is basically the fountain of youth combo.
I love the sound of that.
It's designed to support collagen synthesis, improve skin elasticity, and optimize systemic aging markers. The timeline here is longer, though.
How long are we talking?
You're looking at 8 to 12 weeks for visible skin improvements and 12+ weeks before you'd see deep systemic changes.
Okay, patience is key. So the core of this stack is GHKQ dosed at 1 to 3 milligrams monthly.
Yes.
And that's paired with our friend BPC-157.
Yeah.
But they also throw in senolytics in this stack, specifically docetainib and quercetin. Wait, before we move on.
Oh.
For the listener who might not be familiar, seno means old and dolitic means destroying. Right. Are these essentially clearing out zombie cells in the body?
You hit the nail on the head. As we age, some of our cells stop dividing, but they refuse to die.
Like literal zombies.
Exactly. They just sit there, secreting inflammatory toxins that accelerate aging in the healthy cells around them. These are senescent cells, or zombie cells.
Ooh, okay.
Yeah, so senolytics like dasatinib and quercetin are compounds that specifically hunt down and clear out those zombie cells, which massively lowers systemic inflammation.
Fascinating. And what about the GHKQ? How is that actually improving the skin?
So GHKQ is a naturally occurring copper peptide. When you introduce it, it acts as a signaling molecule.
Signaling what, exactly?
It physically signals your fibroblasts, the cells responsible for making connective tissue, to ramp up the production of collagen and elastin. It's basically telling your body to manufacture the structural proteins that keep skin firm and youthful.
That's incredible. But again, Claude comes in with a major safety catch here regarding the GHKQ.
Yes, Claude flags two very important things. First, because GHKQ binds with copper, it can interact with your body's iron and zinc metabolism.
Oh, so you could throw off your mineral balance.
Exactly. You have to monitor your mineral balances closely. Second, because of its massive popularity in anti-aging circles right now, counterfeit versions of GHKQ are incredibly common.
Of course they are.
Right, so Claude emphasizes that you must only buy from labs that provide rigorous third-party testing.
We will definitely get into how to verify those labs in a minute. But first, let's transition.
Let's do it.
We've optimized the muscles and the skin, but none of that matters if the command center is degrading, right?
Yeah.
Which perfectly sets up our third stack, cognitive neuroprotection.
The goal here is leveling up brain health, improving memory, and actively protecting against neurodegeneration.
And the timeline.
You're looking at 8 to 12 weeks for improvements in mood or anxiety, and 12+ weeks for tangible cognitive gains.
Okay, and the protocol.
The protocol utilizes cerebrolysin administered at 5 milliliters intravenously twice weekly. And that is stacked with BBC 157 and Selenk, both at 250 micrograms daily.
Okay, so the source mentions that this stack works through BDNF upregulation and improving GABAergic tone.
Yes.
Can we ELI5 that for a second? Like, what do those terms actually mean for a normal person?
Absolutely. So BDNF stands for brain-derived neurotrophic factor. Think of it as miracle grow for your brain.
Miracle Grow, got it.
Yeah, upregulating it means you are telling your brain to grow new neurons and create new synaptic connections. That's what the cerebrolysin does.
And the GABAergic tone, what's that?
Well, GABA is the primary inhibitory neurotransmitter in your brain. It's basically the chemical that tells your nervous system to calm down, reducing anxiety and stress.
Okay, I definitely need more of that.
We all do. So Selenk works by improving your GABAergic tone, meaning it optimizes how effectively your brain uses that calming chemical.
I really love how ChatGPT explains this combination. Combining cerebrolysin for growth with Selenk for calm is literally like upgrading your brain's hardware and its software at the exact same time.
That is a perfect way to put it.
You're physically building new neural networks with the Miracle Grow while simultaneously smoothing out the chemical signals running through them.
It's a very elegant biological protocol. But once again, Claude throws a massive red flag here. Cerebrolysin is not FDA approved in the US.
Right. So if I'm listening to this at home, how do I actually execute this if it isn't FDA approved and requires an IV?
Claude warns that you must rigorously verify your local regulations. In many places, everyday people cannot just order IV cerebrolysin online.
That makes sense.
You often have to seek out specialized licensed offshore clinics or specific longevity centers operating under different regulatory frameworks. Claude ensures you don't accidentally cross legal or safety boundaries trying to procure it.
Here's where it gets really interesting, though. We've talked about these incredible outcomes. Healing injuries in days, reversing skin aging, upgrading your brain's hardware.
It's powerful stuff.
But with great power comes the potential for spectacular mistakes. If you're listening to this and getting excited, we need to completely shift our tone for a second.
Yeah, we really do.
We need to talk about the don't mess this up guidelines.
Because the margin for error when you are biohacking your own biology is essentially zero. You have to be meticulous.
Absolutely zero.
And the very first major trap people fall into is the myth that more equals better.
Right. And I'm going to push back the way a lot of people naturally would.
Okay, let's hear it.
If 250 micrograms of BPC 157 makes my shoulder feel great, human nature says 500 micrograms should turn me into a literal superhero, right? I want to heal twice as fast.
It's such a common thought process, but the biological data firmly debunks this.
Really?
Yes. Our sources point out that doses above 500 micrograms daily actually show diminishing returns. Your cellular receptors can only process so much of a peptide at a time.
So it's wasted.
Exactly. It's like pouring a gallon of water into a tiny sponge. The sponge absorbs what it can, and the rest just spills all over the counter.
Oh, that's a great visual.
The sweet spot where you get the most biological benefit without wasting the compound or risking receptor downregulation is 250 micrograms. Doubling the dose doesn't accelerate the results. It just empties your vial faster and introduces unnecessary side effects.
Okay, so variable control is a huge theme here, which brings us to the supplier warnings. You cannot just look at a shiny website, see 5-star reviews, and assume the product is safe.
Never.
You mentioned third-party testing earlier, specifically HPLC and mass spectrometry. For the listener, what are those tests actually looking for?
They're looking for absolute chemical purity. HPLC, which stands for High Performance Liquid Chromatography, separates the components in a mixture to tell you exactly how much of the active peptide is actually in the vial.
Okay, and mass spec.
Mass spectrometry measures the exact molecular weight. Together, they confirm that you have the precise molecule you paid for, and more importantly, they confirm the absence of dangerous byproducts, heavy metals, or toxic solvents left over from the manufacturing process.
Yikes. Toxic solvents.
Yeah, it happens. If a supplier cannot produce these certificates from an independent lab, run the other way.
Good advice. And even if you have the purest peptides in the world, you cannot just dive in head first. The sources outline what we'll call the introduction rule. Do not take the kitchen sink approach.
This is critical. If you launch 4 different peptides simultaneously on a Monday, and by Thursday you develop a rash or heart palpitations or crippling lethargy, which peptide caused it.
You'd have absolutely no idea.
Exactly. You wouldn't know if it was an allergy to the TB500, a reaction to the GHKPU, or an interaction between the two.
Right.
That's why the absolute rule is to introduce only 1 new peptide at a time over a 2-week period. This isolation allows you to accurately track any side effects and attribute them to the correct compound.
It's just the basic scientific method applied to your own body. Change one variable at a time.
Precisely.
And speaking of science, the last big mistake to avoid is overtrusting a single study. Just because Perplexity found one paper from 2026 saying a peptide is a miracle cure doesn't mean it's an established fact.
Right. Real scientific evidence requires convergent data. It requires multiple studies, larger sample sizes, and replication across different independent labs.
Yeah, AI is fantastic at surfacing information quickly, but you still have to apply critical thinking.
You must look for that convergent evidence before committing to a months-long biological protocol.
Okay, let's unpack where we are. You are now armed with the tools. You know the exact three-layer AI workflow: the detective, the lab tech, and the judge.
Mm.
You have the blueprints for the optimal elite stacks for recovery, longevity, and cognition. And you have the non-negotiable safety rules etched into your brain. There's only one thing left for you to do.
Take action. Knowledge without application is just trivia.
Yes, having this futuristic knowledge isn't enough. The fastest person to safely commit to a goal wins. So here are your exact action steps.
Ready.
First, pick exactly one goal. Don't try to boil the ocean and fix everything at once. Choose recovery or longevity or cognitive optimization.
Second, run your chosen goal through the workflow. Use Perplexity to find the latest real-time data. Use ChatGPT to understand the underlying mechanisms. And use Claude to strictly validate your stack against your personal health profile and medications.
Third, once you have your verified, safe protocol, execute it. Track your results meticulously for 8 to 12 weeks. Document everything: your mood, your sleep, your pain levels.
Track everything.
And finally, if you want to stay on the absolute bleeding edge of this stuff, you need to join the Peptide Visuals newsletter. They are constantly sending out the latest clinical research, the newest AI prompt tools, and real-world optimization protocols straight to your inbox.
It's really the ultimate cheat code for staying updated.
It is a phenomenal resource because this field is moving at breakneck speed. Which leaves me with a final thought for you to mull over.
What's that?
Today we've discussed how 3 highly accessible free AI tools can essentially compress a decade of fragmented biological research into a single afternoon.
Yeah, it's wild.
If this level of democratization is what we are capable of right now, in 2026, how will this rapidly accelerating technology redefine the absolute biological limits of human lifespan and performance in the next 5 years?
It makes you wonder, doesn't it? The roadmap is there. The AI is your GPS. Just remember to keep your doctor in the passenger seat and drive safe.
Couldn't have said it better. We'll see you on the next deep dive.